I've had like crazy requests. I think honestly, it's the some people that try to get what they just can't get. I've had people that want to have, like, let's say Brazilian butt lift, which is a fat transfer, and I'm literally standing in the mirror with a patient and asking them, "So where's the fat?" Because there is no.
It would be like me trying to get a back. Like there's nothing. Where is it going to come from?
Yeah.
My eyelash. I don't
One of the
know.
things that people don't know is, so when you suction, when you do the liposuction and suction, you need about 3 to 4 cc's of fat to process to get 1 cc of fat to inject. So usually you want to do 400 to 800 cc's in each butt to actually see a result. And you know, fat transfer has gotten a very bad name recently because people have died from the procedure when you inject it too deep. So you really don't want to be too aggressive with that. So you need to know that you can harvest enough fat to do the procedure. Now, some people will still go ahead and do it because they know that if you can thin the waist, it already gives the illusion. But I try to be very brutally honest with my patient and say, listen, we can do your liposuction and improve this, but we probably won't have enough fat that'll make a difference. So those are kind of like the things that I've had that are crazy. I haven't really, luckily, I think maybe because I pre-screen my patients, I haven't really had any like really outlandish, like, can you put my breast implant in my butt kind of questions. So, yeah.
Okay, you know, it's really interesting because the first time we talked, we're trying to prepare for this. One of the things that stood out about what you said was just that, is safety, right? Like thinking about safety. And, you know, if there are some requests that seem normal to a patient, but are so dangerous that, you know, there's no way we can actually literally approach that request.
Yeah, I've heard people, I've heard stories, I've even had patients tell me about how they've gotten like butt injections with things like silicone in somebody's garage or something. And it's like, I'm literally freaking out in my mind because I'm like, why would you think that's safe?
Right.
You know, because
why would you go to some shady motel and think that's okay?
That's what I'm saying. I mean, it's just not safe. It's not, I don't care how much money you're saving. You know, one of the videos that we've posted is about an unfortunate patient that actually had what we believe was a fat transfer, but it got infected. Now, obviously, I wasn't her initial surgeon, so I'm not quite sure the circumstances, but complications are real. They do happen, which is another reason that, you know, I'm not a fan of tourism. I've operated on patients that, are from out of town. I pre-screened them even more strictly than, you know, so for instance, when I moved to Memphis, I've had at least like 2 or 3 of my patients that have come from Memphis for here. I make them stay at least a week. I check on them frequently and make sure they have family support. And even then, I'm still a little bit uncomfortable because I'm like, what happens if something happens? And obviously, this is somebody I've operated before. So this is somebody I already know very well. So you definitely don't want to have anything go wrong. So yeah, it's really important to know that complications do happen. So you gotta choose carefully and doing things that don't make sense. Usually if you have a sense that it doesn't make sense, it's because it doesn't. So,
trust your gut.
Yeah.
Trust
absolutely.
your gut.
Yeah.
All right. So during the initial consultation, I know what you're going to do for the patient, but let's say a patient cannot make it to Posh Mansfield. What should they expect will happen during that initial consultation?
Oh, so what should it? So basically, you come in. My staff are always smiling. They welcome the patient, or register the patient, go through the medical history, take them back to the room, depending on what they want to do and how comfortable they are. One of my nurses and medical assistants will interact with them, and then if, for instance, they're there for Mommy Makeover, they would ask them to change into a gown. And then I'm always chaperoned when I see a patient, reason being that I want to make sure the patient is comfortable. And then at some point during the conversation, once we've checked off that you're medically able to have what you're asking for, I ask them what their goals are, and I have them give me like basically stepwise, like which one's your most important, like give me your own shopping list. And then we'll then do the examination. If we're doing a breast exam, we'll do a breast examination, do abdominal examination, and I still listen to the chest and the heart before we have surgery because I want to make sure that everything's ticking and moving well. And then usually we'd give them a quote for the procedures. We normally would do the procedure. If it's something minimal, we'll do it in the office. If not, we'll do it at a surgery center. And we'll give them a quote to cover everything. I like to do like a boutique pricing where they get a quote that covers everything. That way they're not getting bills from different places. And they just get the one price. Yeah. Yeah.
So you started to talk about the prices. Are you going to tell us average? Because everybody stayed on this live just to find out how much this cost and how much oodles and noodles we're going to have to eat so we can get our body together.
So one person's tummy tuck is different from another person's tummy tuck. It's not cheap. On a general, there's usually a range for something like a tummy tuck would be between 10 and 12,000 for everything, for the entire package. Obviously, the heavier you are, the larger you are, and that would usually include some liposuction. If we need to add more, that's more. A breast augmentation, including the implants, is somewhere between $6,000 and $8,000. But I always hesitate to say all that because then somebody's gonna come in and listen, I watch you on live and you said it's $6,000 and that's all I'm paying. And it just happens that they're really
That's me. I'm coming to you and telling you after I have my babies, Dr. Ben, you said 6,000 5 years ago.
Oh yeah, that's another thing. I try to make sure the patient knows, listen, because some people shop around, and I'm okay with you shopping around, but the quote you get is for 30 days. You don't want to come back 6 months later because there are
that would be me.
Like, hey, yeah, I got this quote last year. Let's go ahead. I'm like, yeah, that was
sale prices. That was post-COVID special.
Yeah. No, with COVID, we've been telling people, listen, if you book your surgery, we'll give you $500 off. That's good. It's helpful.
Oh, so we can shop now. Okay.
Yeah.
Well, there you go. If you got your coins together.
Yeah, absolutely. Well, in this day and age, you have to. We do take credit cards. We do take care credit. So we do have payment options. So you don't have.
Oh, Dr. Ben. So you're really gonna be telling these people to put their breast on credit card? I don't like it. So I don't like it.
So here's the thing: for as long as you can afford it, that's it. That's a conversation that you and yourself and potentially a significant other should have. You don't. Again, it's elective cosmetic surgery. Just like people put their phones on credit cards and stuff. It's not. I'm not a financial advisor. I don't want you to do anything you don't afford.
That's fair.
That's it. So.
Awesome. So. You started to talk about like some of the risks that you can see with cosmetic surgery, and I wanted us to kind of talk about generally because each procedure is going to have a different kind of risk. But generally, what kind of risks should a patient anticipate, and how can they minimize those risks? For instance, like I tell my patients, if I'm going to operate on you, you cannot be a smoker. Unless it's a, life-threatening thing that I'm doing for you, you need to stop smoking because you're going to have poor wound healing.
That's correct.
That's what I'm asking on your end.
I'm so proud of you of bringing that up because that is key. So, like you said, there are specific risks for each procedure. The ones that are kind of like catch-all for everything and one, depending on what kind of anesthesia you're having, there are anesthetic risks. If you're being put to sleep, then, right now the anesthesiologist will tell you that the risk of you having a problem from being put to sleep for a procedure is actually less likely than you walking out on the street and getting knocked down by a car. And that is true because the risks are low, but the risks are there. And the more health risk factors you have, the higher those risks. Now, talking about more smoking, I don't do elective cosmetic surgery on smokers, period. Because for everything that I do, I need it to heal. Because that tummy tuck cannot look nice if you don't heal. And that's really important. There's 3 cosmetic surgery procedures that you have to be off tobacco for at least 6 to 8 weeks, which would be a facelift, a breast lift, and a tummy tuck. The reason is simple. The skin flaps are pretty thin, and with those thin skin flaps, then you could have a problem if you're smoking. So smoking is a big no-no. Things like liposuction. Liposuction is the commonest cosmetic procedure done. Well, liposuction in the wrong hands can be dangerous, and that's very important to know.
Very, very dangerous.
Yeah, when you're doing that initial evaluation, we do what's called a pinch test, where we can pinch how much fat is under. I do this thing where I ask the patient to suck in the belly. The reason I do that is that tightens the muscle, because the fat that you can access with liposuction to remove is between the skin and the muscle. You don't want any muscle bruising, you don't want any muscle penetration, because your organs are behind. So you remember our former leader's wife, Stella Obasanjo, right? The gist was that she died from a liposuction procedure. And I felt really bad because, you know, I think I was still in training then, so she couldn't come to me, but that it does happen. So these are real things, you know. So yeah, so there are different risks. With breast surgery, okay, breast implants are probably the second most common major elective cosmetic procedure.
I mean, you live in Dallas. So.
Yeah. So basically, you can have something called a capsular contracture, or you can have an infection. Those are the two more common ones. Capsular contracture means that the breast becomes hard because your body's going to form an abnormal capsule around it, and that would require reoperation to treat as well as medication. So there's multiple different risks that are involved. And I tell people, listen, if I tell you all the risks, you're probably not going to do the surgery. So that's why you want to make sure that you're dealing with somebody who's thinking of the risks as they're operating on you.
Okay. So before, we're probably going to wrap up pretty soon, not because I don't have more questions, but because I just went on 10% on my battery. I've been trying. Well, my phone has been going off all day. So Dr. Kanisha, who's an anesthesiologist in Houston, and she is a Howard girl.
Right.
She said, do you have mommy makeover patients who needed repeat surgery after having more kids?
Yeah. So usually, that's one thing that I try really hard to talk to the patients about. So if there's even a chance that you're gonna have more kids, I ask you to limit what you're doing to your abdomen to like liposuction. Reason, liposuction, you're not doing a major skin excision, you're not doing a major belly tightening, so that's fine. If you have had a tummy tuck and you get pregnant, it's usually a very uncomfortable pregnancy, because those sutures that we use are usually long-term and permanent sutures. So yeah, it'll be uncomfortable, and you may need to have a revision when you're done. Yeah, things like breast augmentation. If you've had a breast augmentation and you get pregnant, your breasts just look bigger. The downside is that if you have multiple pregnancies after breast augmentation, then your skin might stretch out even more. And then what would then happen would be that you would need to have a lift. And I take that back. There's no need. You may want to have a lift. So.
Yeah. It's very interesting because the hardest C-sections just getting into the peritoneum that I have ever done have been after tummy tuck. And it's kind of the thing, right? You get a tummy tuck, you look good, your man wants some more, and then you get pregnant. So I always tell my patients, like, if you're about to get a tummy tuck, let's talk about birth control. Most of these babies are unplanned. So the woman is like really pissed off the whole time about it. You know, it's a lot of emotions going on. So, all right.
Yeah, I hear you.
So I think it's Shanita Sharid. She said, is it true that if you remove fat one place, it can come back in another place? A lot of people just ask me that, like when they have liposuction, do they have ectopic adipose tissue? And you see some patients that come in looking like footballers because they have a tiny waist, but then there's fat everywhere else. So tell us about that.
So that footballer analogy is a pretty good one. I'm going to give a quick shout out to one of my patients that actually just made a comment. Her name is Erica, and she just said, best surgeon ever. Thank you. She's one of my favorite patients.
Yes.
Online. But anyway, so the way I describe it to folks is this, right? Once you hit like maturity, puberty, so about 15, 16, you're going to have the same exact number of fat cells till you die. Now, prior to that, your body's making fat cells. Now, what then happens after? Now, fat cells are obviously really small, but they're in the millions to billions in the body, right? And they're distributed different places. In fact, there's different parts of the body. When you cut through, you see different colors of fat because there's different types of fat, all right? So again, there's fat that's around the organs, which is the visceral fat, and then there's fat underneath the skin, right? If you liposuction one area, I tell folks I can usually remove 60 to 70% of the fat there. You cannot remove 100% unless you literally cut it out, right? You following? So that's really, really important because you remember when we talked about liposuction and risks of penetration and stuff? So if you're being overly aggressive and you're trying to get 100% out, that's when you have that problem. That being said, there are techniques where it's called a tumescent technique. We inject the local has lactated ring in it. It breaks down the fat cells and it allows us to suck it out. So those areas that you've sucked out will have probably 20 to 30% of the fat left, right? However, if you add weight sequel to that, right, you will add more weight in the areas that you didn't suction, but you can still add some weight in those areas that you did suction. Now, the difference is you now add way more weight in the other areas. So you always have that disparity, you know. So, yeah. And that's one of the reasons assessing the patient pretty well at the beginning is very important to make sure that liposuction is supposed to be for localized areas of fat deposition, not for your whole body, basically. So
awesome. Before my phone dies, I want us to get this information out. First of all, people can follow you on Dr.Posh.Mansfield. Yes. And then they can also Google Posh Mansfield, correct? To be able to find you.
Reconstructive surgery Mansfield, that's right.
Right. Do you want to give us your number? Do you want to say it out loud?
It's actually on the IG page. It's 682-400-2152. Yeah. And I'm going to interrupt right quick before your phone dies. There's somebody here that's saying, question, should you complete your childbearing before breast augmentation? Not necessarily. It depends. If you're just about to have a baby next year and be done, fine, no problem. Because again, done, fine, no problem. Done, fine, no problem. Because again, the downside is you may need to have a lift because the breast stretches out more. But a couple of things. Breast implants, most implants that we use right now are silicone. They've already checked this. If you've had a breast augmentation with a silicone implant, they've tested women with their breast milk after silicone breast augmentation. The amount of silicone in that breast milk is less than the amount of silicone that is in baby formula. Yeah. So it's not a risk at all. So you may choose to finish having kids before you do this, but you don't absolutely have to.
Oh, awesome. So Dr. Oma, thank you for coming. She's one of my friends, my dear friend. She's a meds peds in Houston. And nice. Mrs. G, yes, thank you very, very much. Thank you guys so much. If you have questions for Dr. Ben, slide in his DM.
They can just
please be respectful. He's a plastic surgeon, but he definitely doesn't want to get your breast in his, he's a married man, okay? All right. Thank you, thank you. I hope you guys learned something. Oh, hi, Doctor. Yes, okay. Everybody is saying hi. Thank you, thank you, thank you. Guys, check out Dr. G, Dr. Ben. I'm giving her all new names. Dr. Posh. I think you need to go by Dr. Posh. I like that name. Yeah. Yes. Yeah, you are awesome. Thank you for your time. And we're around the corner for each other, so my patients will be seeing you. All right, guys. Thank you for being here. Thanks. Bye.
Bye.